Hi, everybody. It's Dr. Laura Hanson with Connect My Brain. I'm so glad that you're with me today. We are diving into the reflexes. I just love the reflexes since I have utilized this amazing insight that I have been learning for such a long time. I think it goes all the way back to like 2006. It has changed completely understanding how the nervous system gets wired up. So in our last episode, we got started with the reflex system. So there's a lot of good beginning information about that reflex system. We showed a video and we showed a picture. So if you have the opportunity, go over to YouTube, Dr. Laura Hanson, and you will be able to see the podcast and the different things that we are sharing on the screen, as well as, of course, listening to the podcast. And by all means, share this information because this is what I love to do. I love to share information. I love to open up people's minds and help them understand there are so many pieces to what goes on in these brains and nervous systems of ours. And when we get bigger picture, we can really connect some dots and we can make some really profound changes. And that's what I really think the reflex system does. So the first one that we talked about was the foundation, was the withdrawal reflexes. Now we're going to dive into the primitive reflexes. So these come in at different times. So around 9 weeks of pregnancy is when we shift into the primitive reflexes. And the very first one is called the Moro Reflex. And it should integrate, it should be fully present at birth, as well as it should integrate by around the 4th month postnatal. So when these reflexes do what they're supposed to do, they are literally putting that neurology together. The reflex system is considered central pattern generators. It precedes sensory motor. So even when we have a lot of people, a lot of kids come in and they've got some kind of sensory motor diagnosis label or somebody suspects that that's the problem, these actually are the training ground before sensory motor basically take over. But at any time, reflexes can reemerge. Now, they're typically going to reemerge if for some reason something happens in a child's development that then we would start to say they are regressing. So if a child regresses, they're going to move back from where they are to that brain stem. And remember, when you're born, you are fully formed, but you are brain stem dominant. And what you're trying to do is you're trying to have an experience, motor around, touch things, put them in your mouth, explore the world. What do you hear? What do you see? What do you feel? What do you smell? What do you taste? And those special senses are key in providing the electrical information to the brain. They are also part of every single one of these reflexes that we are going to be discussing over the next several weeks. And so this is how the baby early on is exploring its world through its special senses as well as through its body. And I would always say that I would put the vestibular system in as a special sense because it is the one that drives movement. And movement is absolutely imperative to get the brain to wire up. By year 1 or 2, your brain is already firing up the midbrain. So if we really think about it, the first couple of years, the first 3 years are so important. And let's even re-clarify. it's not just what happens out here after you're born. The 9 months that you are in the womb are incredibly important too. As we discussed, that's when the withdrawal reflexes emerge. That's when the primitives emerge, meaning they come online. So really, I would say it's closer to the first 4 years of life, and we are including gestation during that time frame. So vitally important. So much going on. I always refer to these as open windows of development. And when they're open, it's absolutely magical, all the things that are going on. And if you've ever had a little baby, you got to remember sitting there just looking at them going, look what they can do today. And it's just incredible how fast things can come together. So today what we're going to focus on is the first primitive reflex, and it's called the Moro Reflex. This is also the reflex that really got me into neurofeedback because I was always trying to explain to a parent if that child had a retained Moro Reflex. Now, after you get past 4 months, it is typically renamed to the startle reflex. And that may sound more familiar to you. So we're just going to kind of use them interchangeably so that we have a really good understanding about what we're talking about. But prior to 4 months, it is called the Moro Reflex. And it is going to activate 3 things in the neurology: arousal, CO2O2 reflex, and the sympathetic nervous system. Now, once we get to CO2O2 reflex, this may be a little sensitive information, and I would encourage you, please guard your audience as well as your own heart, okay? But again, we're trying to give out important clinical information that can make a difference in somebody's life. And that's always what I am trying to accomplish, because there's many, many people that do not know how their bodies actually get wired up. So because of the sympathetic nervous system part, you may also know the sympathetic nervous system as fight or flight. So we're going to also use sympathetic and fight or flight interchangeably so that we know what we're talking about. The foundation of the work that I really try to focus on when I'm working with somebody is if there is a heightened stress. There are so many physiological events that are going on inside of that body that I want to break that pattern. And that's why the Moro Reflex really stuck out to me during my training, because one, it's the first one. I always think of it as the enchilada of all reflexes. And in fact, I have never met any child or any adult that did not have a Moro Reflex in conjunction with other retained reflexes. You will typically see this reflex anytime the reflexes are not integrated by the pure nature of the physiology that it has wired up: arousal, oxygen, and sympathetics, fight or flight. So early on, when I was trying to demonstrate that to parents, there's a startle, meaning the movement. They couldn't see it quite the way I could see it. And that's what led me to my first piece of neurofeedback equipment. And even today, we measure the stress response in the body. It is that important. If a person is stuck in a chronic stress pattern, they will be stuck in so many things. They won't be getting great blood flow everywhere. It moves from the front of the brain to the back of the brain when you are in a fight or flight. And that is your brain acting in response to a perceived or real threat and it's getting ready to fight or run. So because that's where your cerebellum is, it's literally going to shift out the blood to your arms and legs in preparation for you to defend yourself, regardless if it's you're going to run or you're going to fight. And you can see this, especially in children, because they will, because the frontal lobe will not be working in its inhibitory capacity, meaning putting the brakes on, they will overly react and they will start swinging and they'll start running. Seen it many of times. So if your child is having lots and lots of meltdowns with lots of reactions, most likely, I would always measure it, but they're probably stuck in a chronic stress pattern. And if this is the pattern that you're in, regardless of how far back this goes, but especially under the age of 8, you're getting stuck. And this is becoming the lens in which you look at the entire world and how you respond to everything. So it is so important to break that pattern. Now, arousal is just what it sounds like. But first, we're going to take it from infancy. And it means that the baby has an alarm clock going on inside of it. Glucose is used up in the brain, and they are awakening. And when they awaken, they are going to cry because now they need to be fed. And early on, that's a big part of what Moro is all about. It is alerting everybody, I have a need. I might be cold and wet. I might be hungry. I might be tired. There might be too much noise. There might be too much of anything. And so that baby is going to startle, have a reaction, and they're going to cry. Okay? Now, the CO2O2 reflex. Unfortunately, when we have a situation where a baby comes into this world and this particular reflex is under aroused, meaning they might be sleeping through the night. And newborns should not be sleeping through the night. They should be waking up every 2.5 to 3 hours. This could be already a baby that's being seen by their medical provider because the baby is stopping and not breathing intermittently. And they may have a heart rate monitor on them. And this, unfortunately, has been some of the patterns that we have seen with children that have actually died from SIDS. So if the nervous system is under aroused, the brain is not getting the message to wake up. And so remember, this is CO2O2, and it's monitoring how much oxygen you have and how much CO2 is there. So if I'm not becoming awake when you have this reflex, you literally, when you arouse, you take a deep breath in. So people in the podcast, listen, those watching, you're going to see, but the very first thing that happens when this reflex is initiated, the baby is in flexion, it's aroused. It's literally going to take in a big amount of oxygen to help regulate its system. When that system is under aroused, it's not becoming startled. It's not getting the oxygen. That CO2 is climbing. And unfortunately, that does not have a positive outcome. And then, of course, we've been talking about the third thing of Moro is the sympathetic nervous system. So these reflexes are so important. And these were literally taught in medical school. However, they're now taught everywhere. But how many times are people actually looking at these reflexes when the baby is born and then at any subsequent visit? So I'm going to share my screen with you. I want to show you what it looks like to examine that Moro reflex. So for the podcast audience, and there is no volume with this one, the doctor literally has that little baby up in tight flexion. So under 4 months, that's what it is. Babies are in flexion. And so what he's doing is he's making a transition, a quick movement, and it startles the baby. And what you see is that baby's flexed arms and legs literally move out into extension. And you can even start to see that the baby cries. And yeah, it's a little bit of a drop. So I do understand why that baby is crying. There's so many other ways of testing it. You can literally clap your hands really loud right beside the ears and see that baby startle. You can even give a little pinch and you'll see the baby startle. It's a very heightened response, especially the first few months postnatally. So anything, it's tied to every single one of our special senses. So any sudden or unexpected occurrence of any kind is going to lead to a startle response. Any type of change in the head position is going to cause a startle. Any type of loud noise. Any sudden movement in the light, so anything visually, and then any type of temperature change. And we often see this, especially if you move into a room that's cool with the air conditioner, and the little baby will definitely move. So it's tied to every single one of your senses. So what happens when we have a Moro response? There's an instantaneous arousal response. There's a rapid inhalation, a momentary freeze or startled, followed by expiration, and often accompanied with a cry. As I started to really look at this particular reflex, I really believe this is the beginning of heart rate variability in our physiology, because it is a rapid inhalation and it is followed by expiration that is longer than the inhale, just like heart rate variability. It is automatically the activation of the fight or flight response, which is our sympathetic nervous system. We are going to have a release of adrenaline. There's going to be an increase in the rate of breathing, and we could even see a little hyperventilation. There's an increase in heart rate, an increase in blood pressure. There's a reddening of the skin, and possibly followed by tears. So this is a physiological reaction that also is exactly the same every single time we have a fight or flight response. So again, the training of this was being set down 9 weeks in the womb. And now it is a part of our physiology. So lots of times, the types of questions that I ask in my intake form, let's spend the remainder of our time really tying this back. What happens to the individual, especially the child, if this reflex doesn't integrate like it's supposed to? And there is usually a picture of stress that is going on, and that picture of stress can be many, many things. But especially all the babies that were born the last 3 years of life. So what you can see in your toddler, your school-age child, let's look at that vestibular system, which is inside of your ear. Lots of times people check off motion sickness. And we actually test the vestibular system when we're doing a developmental assessment because it is such a powerful system. And I am going to spin the child. And I find it very interesting because there's usually just a handful, but they will literally say to me, I'll say, okay, you're going to get in this chair, you're going to crisscross applesauce, and I'm going to spin you. And they look at me and they go, and I'm probably going to throw up. So to be 5, 6, 7, 8 years old and that be your response, I really wouldn't even have to put you through the spinning because I already know that your vestibular system is not accommodating your world. And your vestibular system is all about movement. It is 3 different axes, 3 different canals, and it is continuously monitoring where you are in space. So children that have balance issues, children with low tone, children that are afraid to ride their bikes, children that are clumsy or have poor coordination, that is a red flag for different types of vestibular issues. Now, your vestibular system, like the Moro Reflex, is attached to the visual system and the auditory system. So lots of times I will see in the history that especially when they were very little, that they couldn't tolerate loud noises. Now, they could also talk really loud themselves. It can go either way. So children that have a lot of trouble with interpreting sound, processing sound, maybe they didn't lateralize with a dominance of the ear and the eye and the hand and the foot all on one side. Perhaps it's that ear that's on the opposite side. That's enough to give their system feedback that's going to constantly trip them up. Not only for auditory, but also vestibular, also the visual system, also primitive reflexes. And this is what I really want to try to help people understand. There's so many pieces to this. And this is why it can't be a one size fits all. I can have a child whose vestibular system is not working right, but the oculomotor is okay. So I don't have to put all of them together. You rarely find that, but anything is possible. And that's why it is so important to look at a person's development. How did they progress so that you can begin to put the pieces together? They're all going to adapt. They're all going to get older, get taller, move forward, but it doesn't mean that it is done in the most efficient direction. And most of the time, what you're going to see is that it's going to come out in their ability to learn efficiently or what's expected. It might be social. Can you imagine that if you feel like your whole world is just too loud, you don't want to be around anybody. So you're going to automatically withdraw. You're going to go sit by yourself because you just can't take the sound. But you don't have a point of reference to tell somebody, hey, all these people are so loud. I can't stand it. Just recently started working with a little boy. First of all, he just talks so loud, but physically he can put his body together like nobody's business. But what did we find? I got, Mom, go get this checked. Somebody looked inside and there's a little cyst in there. So there can be, but this little guy's been on the planet already 6 years. Now we've got 6 years of development that has been influenced by the feedback of what's going on in the auditory world. And for him, the big thing that has happened, he has become a very highly irritable little person. So what's the connection? Because it's his experience. You can't just sit there and say it's A, B, C. It's the individual experience and how the brain got wired up, what we get to see on the outside. is where the disconnect is happening. And when we get the opportunity to work with a child, because they are so close to the beginning, we can begin to put the proper stimulation in there. We can get whatever other services are needed and bring that neurological system into a functional capacity. It happens every single time. So let's think about what are some long-term effects of a Moro staying retained. And you tell me if any of these happen to match either you or your child or a child that you know. I always make a funny about this one because I'm a recovered Moro. I was a very highly startled individual until I learned about this. And so I got my world to change. I could have been in a deep sleep and I would know if somebody is approaching me, and I would fly out of that bed in a panic. And once I learned what was actually going on, I did the integration for myself and my world has completely changed. That doesn't happen to me anymore. Okay, so I'm going to read some things to you because I don't want to miss anything. So as we said, vestibular system, typically there's physical timidity. Like they don't have the endurance. They have a tendency to avoid sports. And it isn't because they really don't like them. They just don't feel like they can do it. There are usually oculomotor and visual perception problems. They are stimulus bound. Now, I kind of laugh on this one too, because I actually see this driving around Atlanta, Georgia. So people that hover a line or the side of the road, they get really close to it. That's what stimulus bound means. So for a child, they're not going to be driving a car, but they're going to always be stimulus seeking, sensory seeking, you might say, because this particular reflex is not integrated. They might have some sensitivity to light. We also might see when we shine a light in, the black part of the eye called the pupil doesn't react like it's supposed to. There could be possible auditory confusion resulting from hypersensitivity to specific sounds, and they may have difficulty discriminating the differences between sounds, like a B and a D. So that's very important. They're also with the auditory. So for example, when I do my developmental assessment, sound, when you come into this world, you know low frequency sound. When you come into this world, you know low frequency sound. You have to acquire middle and high. So, and that's during the first 3 years of life. Now, remember what I've already been talking about. These are such sensitive windows. First 4 years, one of those years is including pregnancy. Now, one of the next things that can occur from a retained Moro, allergies and lowered immunity, asthma, eczema, history of frequent ear, nose, and throat infections. Why would this be? Well, if your fight or flight is up all the time, you're not feeding the immune system. Plus, the immune system is developing the first 3 years of life. Again, another open window of development that's receiving a feedback from a retained Moro reflex, and therefore it's going to influence how that system is actually going to develop. They could have adverse reaction to drugs, poor stamina, dislike of change or surprise. They can't adapt very easily, poorly developed CO2 reflex, and they might be reactive hypoglycemia. Some physiological events, they may have this free-floating form of anxiety, excessive reaction to stimuli, mood swings, tense muscle tone, a lot of body armoring. They can't accept criticism. They have a cycle of hyperactivity followed by excessive fatigue, difficulty making decisions, weak ego, low self-esteem, insecurity, and they need to control or manipulate events. So, kids that are under adult level controlling your house, that to me would be a classic sign of, let's see if there is a chronic Moro going on in this child. A child that has had quite a neuroimmune or heightened immune responses, lots of illnesses, very high stress response going on in their system. Physical stuff, poor tone, excessive fatigue. I do an endurance test on every single kid that comes in here, and I am absolutely amazed. These children have no energy. So in the big picture of things, most of the time, this is what is going on, is a heightened stress response. So what are we going to do? We're going to measure it. We can measure this response and see if it's chronic. That's going to help you know why your child is going through what they're going through. Now we know the pattern that we need to break. And it is going to have to be the full body experience, because for however long that this has been going on, it has been the influence of how they've gotten wired up to the age that they are. And it's so easy in these chronic stress patterns to fall back into their brainstem and not be able to allow the higher brain to take over. So I started really looking at reflexes, like I said, I think it was around 2006. And it explained what I saw all the time, especially on the little ones. So what was it for the kids over the age of 8? And then around that same time, they came out with a new label, executive function dysfunction. And you literally could see the progression of how the brain comes online, brainstem, midbrain to higher brain, was literally matching all the labels that were coming out on our children, wow, for decades. And let's go back to the pure definition of what Moro activates in the neurology. I think we're clear on the fight or flight, and I think we understand the oxygen. But let's go back to the arousal, especially as it relates to children labeled, diagnosed with some form of attention issue, which now we have all these subcategories. So let's paint the story of how we actually begin to pay attention. It's got to start somewhere. So again, this starts 9 weeks in the womb. It is part of the birth process. It is part of how you are going to learn how to engage in the new world that you live in. It is how you summon people when anything is going on, rather it be how you're being handled, something in the environment, sound, touch, taste, visual, you're going to respond, and it is going to alert you. And if it's a heightened alertness, you are probably, as an infant, going to cry, and somebody is going to come and pay attention to you. Now you go through that, you're taking care of your little one, and that little one is starting to get older, and it's time to think about potty training. Now I'm jumping. This is not the actual sequence of events, but I am trying to highlight some big picture ideas. Children are ready to be potty trained when they can pedal a tricycle. Lots of times people try to potty train too early and it ends up in a regression. I will tell you, your best chance is if your toddler can pedal a tricycle, which I would love to see more toddlers on tricycles, and scooters before that, not the standing scooters, the sitting scooters, where they're literally beginning to use their feet in the proper direction. And they're holding their little trunks up, and they're only a few inches off of the ground. Their next step is to go into a tricycle. But once you begin to know how to pedal a tricycle, you're actually using that transverse abdominis muscle, which sits right in front of your bladder. So we take our little toddler into the potty and we sit them down on the potty. They have no idea what you are doing with them, but you sit there. And maybe you sing a song, maybe you read a story, you have all kinds of things. I would definitely don't bring a device into the potty room. Talk to them, read them a story. That little toddler will begin to relax, and the more pressure that they feel on their little pelvis, they'll eventually tinkle. And when they do, you get so excited and you're ready to throw a party, and they look at you and they're like, wow, something's going on. I have no idea, but I'm going to make my face look like your face because that's a mirror neuron. So over time, we do the same thing over and over and over again. We practice, and before you know it, that little toddler is starting to feel a little something through the bladder, through the transverse abdominis muscle, and they begin to associate that right before they tinkle, they feel this. Everything about that child's development, they must feel it themselves. Okay, back into the potty room. We're moving, that baby, that little toddler's getting it, and before you know it, that toddler's ready to try to do it for themselves. And so they begin to tell you, I got to go to the potty. And over time, we've practiced to now it's you and me. And we're getting ready to go somewhere. I think I'll go to the restroom before we go. Perception. So first, someone pays attention to us. Second, we learn to pay attention to ourselves. Third, now we're ready to pay attention to others. Then that child can go into a classroom and be ready to learn and pay attention. But if I've got poor stamina, if I've got this thing with smells, if I've got a thing with sound, if I've got a mood swing, if I am constantly not feeling good, how can I pay attention? And I've never seen this as an isolated event on any child's history. They typically have all the things that we've talked about. Some type of immune, either history or current event, something going on with their ability to perceive sound, and it could be in one frequency and over another. Could be the way their eyes work. It could be so many things. But if this is at the heart, meaning if I'm in a chronic state of fight or flight, there's no way I can learn right now because the only thing I'm thinking about is how I'm going to survive. But I don't have the point of reference to tell you that. Thank you so much for tuning in today. Again, we are here. Connect My Brain is here to serve our community as well as worldwide. That's why we do these podcasts. We want you to stay connected. Be sure and go to the subscribe button and subscribe to the podcast. And please share this information. Make sure you check out both YouTube channels. Connect My Brain is my older stuff, and Dr. Laura Hansen is all about these podcasts. Go over to the website and maybe download Dr. Laura's developmental milestones and check out our show notes. We want to be a resource of information for our community. And you can also go to the website, connectmybrain.com. If you have a question, fill out the form. Let me know when you're available so we can make that connection happen as quickly as possible. And you're always welcome to call the office, 678-501-5172. Thanks for tuning in. Be blessed.